In this video, I will talk about a classic joint involvement in different types of arthritis. Okay, let's take the color. Yep, good. So classic joint involvement in different types of arthritis. So you have four patterns here, right here. The middle two are the patterns of the two classic seronegative arthritis. This one is for rheumatoid arthritis, and this one is for osteoarthritis. So let's start with the rheumatoid arthritis, the classic arthritis of all. In rheumatoid arthritis, the words to memorize are the arthritis is symmetrical. So you see there is symmetrical involvement of both sides, symmetrical involvement of hands and symmetrical involvement of legs, both. Then there is involvement of both small and large joints. So both small joints and large joints. Another thing to note is there is involvement of both upper limb and involvement of lower limbs. So involvement of small and large joints, involvement of upper and lower limbs. Among the joints, you see there is specifically few joints that are more involved than the others, such as the PAP and MCP joints. This is the MCP joint, this is the MCP joint, and this is the proximal interphalangeal or PAP joints. And interestingly, it does not involve the DIP. It does not involve the DIP. RA, no involvement of DIP, very high yield. Next, let's compare and contrast this with osteoarthritis. So in osteoarthritis, there is involvement of small joints, involvement of large joints, fine. And the joint involvement is usually symmetrical, fine. But what's the difference? The difference is the involvement of DIP. So it involves PIP, fine, but it also involves the DIP. That's a major difference between RA and osteoarthritis, involvement of the DIP. Additionally, it also involves the CMC, the first CMC, carpo-metacarpal joint. First CMC involvement is a classic feature of osteoarthritis. And it involves the large joints, obviously more common than rheumatoid arthritis, such as the knee joint involvement, the hip joint involvement, and sometimes the shoulder and the cervical spine. But classically, the knee and the hip joints are more involved in osteoarthritis compared to the rheumatoid arthritis. But the main difference, I think, for exam purposes, is the DIP involvement for osteoarthritis. So let's talk about another arthritis that also involves the DIP, which is the psoriatic arthritis. This is psoriatic arthritis. So in psoriatic arthritis, as the name suggests, you may have the features of psoriasis. You may have, as it's the seronegative arthritis, you may have sacroiliitis because it's a seronegative arthritis. But what is very important for the exam purposes is the involvement of the DIP. As I said, the DIP involvement is classic for osteoarthritis, and it's also classic for psoriatic arthritis. So in psoriatic arthritis, there is involved the DIP. Additionally, you can find nail changes of psoriasis, such as the pitting, onycholysis, nail dystrophy, which is onycholysis, and you can also find the subungual hyperkeratosis and sometimes Weldorf sign. And if the finger is involved from top to bottom, I mean the MCP, PIP, and DIP, then the finger is enlarged like a sausage. So you can find the sausage-shaped finger in psoriatic arthritis. And obviously you will find skin changes if you search for it. Then this is Angst-Pond, the classic seronegative arthritis. This is Angst-Pond, Ankylosing Spondylitis. In Angst-Pond, obviously you will have involvement of the SI joint, sacroiliitis, involvement of the spine, which is often called the bamboo spine appearance. And additionally, you will have involvement of the large joints. So in psoriasis and ankylosing spondylitis, the large joint involvement is basically asymmetrical. This is the word to remember. The large joint involvement in both psoriasis and Angst-Pond is asymmetrical. And oftentimes they might present with a monoarthritis rather than a polyarthritis. And there will be involvement of single large joints such as knee joint or ankle joint or maybe hip joint. That's all. That's how you differentiate between the different types of polyarthritis. Those are the classic ones. And I have another video where I have discussed a few more. You can check the video along with this one.